That's like the third or fourth most common reason to come here, other than after stroke and migraine.
So we can actually say that epilepsy is quite common in Sungai Petani also.
Yeah, in fact, very much so. Like just last week, we had this pharmacist who has been having fits like epilepsy for like maybe close to 10 to 15 years. That's undiagnosed. Okay, she's a pharmacist, right? She's been trained and graduated as pharmacist, and she started working in GH, and then later on Clinic Kesihatan and a retail pharmacy. All of them were not successful. She couldn't retain her work. She got fired because of mistakes that she was making at work, unable to focus, inability to concentrate. All of these things were happening. So then in the end, guess what? She's now working as a kindergarten teacher.
But there's nothing like cramps, spasm, nothing like that, is it? Just that the concentration is affected.
That's right. Well, there are many different ways of, for the fits to manifest. But this is one such thing where the fits that masquerades itself as a condition whereby the person's cognitive function is actually affected, and they're not able to perform, at the level that they should, even for their level of education. So this is one such example. So when you look at the scenario with her, she struggles. Clearly she was struggling all this while. She's 30 years old now, and she's been struggling for the last 10-15 years from the time she finished schooling. Yeah. So I think that's quite sad. She is now currently, prior to coming to see me, she was under the psychiatrist. They put it down as ADHD. So we had to revisit the whole story, and then went through some diagnostic tests and found that she actually has what looks like temporal lobe epilepsy.
Is there anything can be done?
Oh yeah, she's going through treatment. Within 48 to 72 hours after having started the treatment, she told me that her head felt clearer, that she's now able to concentrate and make more sense with whatever we're discussing with her. So yeah, so I think that sort of correlates with what we saw at the beginning, and so time will tell how things are going to turn out after this.
So basically the treatment used is just by medicine?
That's right, yeah. So you just have to pick the right type of anti-epileptic treatment, because you have established that she has a form of epilepsy. You start treating them, and then you just wait for them to respond. Yeah. And not only that, she also has had few accidents, motor vehicle accidents. Yeah, we talked about this before, didn't we? Yeah. So we said that patients can run into problem when they lose their awareness to their surrounding. So this girl was actually going through all that when she will suddenly have a lapse in her concentration and awareness. Crash. Yeah.
Means that epilepsy causes short-term, loss of awareness.
That's right. Short-term, temporary loss of awareness, and you can even have short-term memory disturbances. So these things can happen, and that's actually pretty much what she was going through. Yeah.
So for a patient, how they actually can tell, like if they are not undergoing those typical symptoms, how they know they should come to see a neurologist?
Sure. Yeah. Then? I think for the starters, it's important to know that when they're struggling to get their thoughts together, and then they are struggling to perform, because going back to the case as an example, just drawing from her experience, we know that this girl has started finding it difficult to perform to her level, level of education, to meet her day-to-day requirements for her background, right? So she's not achieving that. She was not performing, and that's a clear sign. Okay, so just to summarize, if you have difficulties with your memory, if you have difficulties that's not explained by anything else, if you have difficulties with becoming forgetful, and that's clear cut, and others are even pointing out your mistakes, then I think that's the time for you to step out and seek help. So these are the few things that we would expect, beyond what we normally encounter. Like we don't expect everyone to turn up saying that I've started becoming stiff and shaking and bit my tongue and then I had a seizure. My parents saw this, my family saw this. But you don't always have that classical presentation. So these are all a bit atypical. Like what we're talking about is atypical. So these atypical presentations, they take a while. Yeah, it is a bit difficult. You won't be able to see and recognize them up front. It takes a while. So then you can. But if you're struggling and again going back to the same patient again, she has visited a number of doctors over the years, even specialists, and then finally she landed in the psychiatry, field, and then that's when they put it down as ADHD. But the symptoms, even after they started treatment, didn't actually go away. Yeah. So she says that there's a lot of yawning episodes, a lot of sleepiness feeling, lack of energy, fatigue, lethargy, number of causes. And then sometimes these episodes can be very intense during the time of a menses. So that's another clue that hormones can play a part in this as well.
Okay. Yeah. What is happening inside the brain actually? What causes all this kind of?
Okay. Well, now I think we can actually talk about epilepsy. Epilepsy is basically a condition where you have an abnormal surge of electrical activity in your brain, which then will physically manifest as just stiffening of your limbs and shaking, and sometimes this can be accompanied by or preceded by loss of awareness. Even before this thing happens, you can have a few premonitory symptoms where you end up experiencing fearful feeling of just being somewhere familiar. There are a few terms that we use for this type of presentation. We call it deja vu and all of that. So we have a number of symptoms that people can experience. Yeah. So there's a wide variety of symptoms that people can experience, ranging from very mild sensory symptoms, like you might feel a bit like tingliness or numbness. You can even feel like you're having goosebumps, and then subsequently you can start to feel unwell, like restlessness. Also you can have a feeling of just not being able to connect with your surrounding. Yeah, so those strange feelings. Sometimes it's very difficult for the individual to describe, but it has got a wide variety of symptoms. So you have sensory symptoms, you have motor symptoms. Some people just go straight to finger twitching or jerking. That becomes a bit more obvious, and then others go from nothing to just straight up, what we call the classical tonic-clonic jerking of your limbs and your head. So it all starts off with the abnormal electrical activity in your brain. Yeah. So this then can be categorized into two categories, where you have the focal type and then the generalized type. The focal type is something that starts off at one point in place, and then the generalized, the whole brain.
How can it, the seriousness of epilepsy can go until which kind of level? Will it kill?
Well, it can actually. Undiagnosed seizures or poorly controlled seizures can kill people. That has happened before many times. One such type of presentation called SUDEP, sudden unexpected death in epilepsy, also falls into that category where people die from poorly controlled seizures, and this is relatively more common among male who have very poorly controlled seizure, young male who tend to die in their sleep, when they have seizures which were poorly controlled leading up to that event. So this can happen.
So usually it's not like that kind of sudden death, no? Is it?
Well, it is a sudden. It's a sudden death, but it happens most of the time when they are asleep.
Oh.
Yeah. Whereas at other times you can have uncontrolled seizures, which ends up causing something more catastrophic, like somebody gets involved in an accident, or they fall off a high place, or they get drowned while in a pool or swimming areas, because it happens unexpectedly.
Mm-hmm.
So those are also quite risky. Yeah.
So anything that can like damage the brain or affect the electrical activity
That's right.
will just...
That's right, because these things can be a bit unpredictable. They happen at very odd times, and you may never be fully prepared to handle those seizures. So when this happens, and it happens all of a sudden without warning, that's when it really lands you into trouble. Yeah.
My brother fell down from the table when he was very young, and then he was on medication for until standard 6, from small until kindergarten age until standard 6. But luckily now he doesn't need to take the medication anymore. So that means epilepsy can actually recover, is it? Do we call it recovery?
Yeah, there's some individuals who go on to recover from epilepsies, and these are often those who have certain types of genetic epilepsy, categorized as genetic generalized epilepsy. So these patients can grow out of it, but again, time will tell, and how well their control has been previously, and how well they have looked after themselves. These are. It's not all about taking medications and then just living a life with the medication itself, but it's about looking after yourself, keeping yourself well, eating healthy, exercising, sleeping on time, and not consuming alcohol, not getting yourself too tired. So all of these things plays a part, and eventually they may grow out of it. So we tend to see this once they reach maybe in the mid-20s or late 20s, sometimes early 30s. So these things just all of a sudden they disappear. Yeah. So especially more so when the brain has achieved the maturation and completed the maturation process. So that's when you see them getting out of it. Epilepsy is highly treatable, and the condition warrants immediate treatment. And with that, they can improve substantially. Symptoms can be very well controlled. Their lives can be saved.
I think this recording can be named as Atypical Symptoms of Epilepsy.
One day will not be enough to talk about the entire thing, because there are a lot to talk about. When you start talking about atypical, where does it end? Where does it start? So it's so vague. It's such a vague area. We have had people who have turned up here saying that they just don't feel well in their head, or just headaches. I've captured young ladies, I've had at least about 3 or 4 cases who were referred to me as migraine, which didn't turn out to be migraine, but it was actually a form of generalized epilepsy with what we call ictal headaches. That means you have seizure-related headaches. So it is not the headache that you need to be treating, because they were put on painkillers, migraine medication, but they didn't work. So then when we run the diagnostic test, we did the electroencephalogram, we found out that the person has electrical abnormality in their brain. Once we started treatment, targeting towards that all cleared up and the headache went away. Yeah. So this again, that's my point. It's not easy to pick out those atypical cases, but we have to be a bit more vigilant in trying to detect them. And being an epilepsy neurologist, it's probably easier for me to say that because this is what I do. But I think from the layperson's perspective, I think what you should consider is that when some things don't make sense, they don't quite add up, feel free to drop by. We can just try to figure that out together. And if you need to run more tests, we'll let you know. We'll let you know. So normally it just falls into these three main tests that we have to do: a blood test, an electroencephalogram, and an MRI scan of your brain. So we can already get the vital information out of these tests. And if we need to go further, we may then have to do some additional blood tests like antibody testing. Sometimes we have to take your spinal fluid to look for any signs of infection, malignancy, or other types of inflammatory conditions. So from there we can actually make a decision about if you do have a form of seizure disorder, what type of seizure disorder you have. So then we'll just discuss it with you and let you know. Yeah.
So epilepsy is actually the name of disease.
Epilepsy is a term that we use when you have recurrent seizures. So when you have back-to-back seizures, repeated seizures, then you're an epileptic. So it's the name of the condition. Yeah.
So seizure is
Seizure is a form of symptom. So if you have a seizure, it's a sign that your brain is trying to tell you that your brain is struggling, suffering from some sort of ailment. It could have originated as a genetic disorder of some sort, because we see this far more commonly in young adults and children, but also in adults. It's just that the causes are different. So we have different causes for different age groups, and the more older you are, the more likely you are suffering from another brain disorder that contributes to the seizures. So that too needs to be examined.